So we'll be talking on personal hygiene and the basic first aid treatment. Personal hygiene, but there is no how we will talk on personal hygiene that will not talk on the word hygiene itself. So under hygiene, we have personal hygiene. We have a lot of categories of hygiene. So we'll be looking at all the categories one by one. So we are starting with the personal hygiene this morning. So the word hygiene, what do we understand by the word hygiene? In our own knowledge, we don't need to Google. We don't need to search. Hygiene. You know, I said is what we've been practicing every day of our life. So can anyone in the house just try and tell us what the word hygiene means? Thank you, ma.
How we neatly upkeep ourselves. Upkeep of ourselves.
Thank you, ma. Thank you, ma. Thank you, ma. There's a word I got there. Neatly. Neatly. That's the word there. Any other person that wants to add to the definition? Any other one? My boy. Thank you. Personal hygiene. They've taught these children in primary school. They know it.
How we keep our environment clean.
Oh, hallelujah. Thank you. God bless you. God increase your knowledge more and more in Jesus' name. How we keep our environment clean. So that's part of the categories of hygiene we'll be looking at. Environmental hygiene. We are going to check most of the categories too. So the word hygiene is the practice of keeping oneself, that is your body and the environment clean, so as to prevent illness or the spread of diseases. So why do we practice hygiene? It's to prevent illness and to prevent us from coming down with different diseases or the other. When you are hygiene in what we are doing, when we are hygienic, when we are doing it neatly, at least we are preventing some infections. We are preventing some diseases from coming down to our body. So now the question is, why do we practice hygiene? To prevent illness and to prevent us from coming down with some infections, opportunistic infections and all that. I think when I was in primary school, there is a song that our teacher taught us then. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. If you know the song, we can sing along with us. Ló lè ṣẹ́gun àrùn gbogbo. Ìmọ́tótó. 1. Ìmọ́tótó. 2. Oúnjẹ. Ìmọ́tótó ló lè ṣẹ́gun àrùn. So the ìmọ́tótó is hygiene. The Yoruba of hygiene is ìmọ́tótó. So I think we cannot remember that song now. So in primary schools, they are still singing the song anyway, just to teach the kids how to be neat in everything they are doing. So we'll be looking at the songs, the lyrics of the song. We'll be looking at the categories of ìmọ́tótó. We said ìmọ́tótó ilé, ìmọ́tótó ara, and ìmọ́tótó oúnjẹ. So we'll be looking at all these categories of hygiene. So firstly, we'll be starting with personal hygiene, which is the main topic that was given. So I just want us to understand what the word hygiene means before we before we bring it down to all the categories aspects. So firstly, we'll be starting with personal hygiene. What do we mean by personal hygiene? You know, we say hygiene is being free, keeping our body, keeping our environment, just to prevent us from coming down with some infections, from some diseases. So now we say personal. This needs to do with us. It is personal. It is your body. How do we take care of your body? This is personal to you. You know, at times when we were weak, when we don't have enough of strength, we can hire an house help to help us in doing some house chores because we are weak, because we don't have strength and all that. But you can't hire anyone to take care of your health for you. If you hire anyone to take care of it, that means it has fire. We won't get to that stage in Jesus' name. So personally, it needs to do with the whole entire part of our body. All the parts of our body. That is what we meant by personal hygiene. Starting from our hair. How do we take care of our hair? How do we take care of our hair as a woman, as a man? How do we take care of our hair? Because this needs to do with most women and girls. You know, we keep our hair, we want to do virgin hair and all that. We shouldn't make it dry. We should try and apply creams. apply to avoid dryness of the scalp, so that to prevent some infections of the hair. So I think applying that, and not only that, we should get our own personal hair kits whenever we want to go to the salon to make our hair. Because, when they use a comb that has been previously used by someone that has a dandruff, and you use it, there's transfer of infections. So I think we should try and get our own personal hair kit as woman and a girl child. And for our men, we should have our own personal hair clippers too. In fact, it is dangerous. Using another person's hair clippers, it can transfer. In fact, not only all these opportunistic infection, HIV, if the clipper got caught on someone that is already infected with this HIV, and same clipper was used, not sterilized. Same clipper was used to your own hair too, and it got caught again. So that's blood transfusion. So we can get contact with all these infections. So that's why it's very, very necessary we get all these kits to ourselves. So though it's not easy, but at least when we keep it and we have it in mind, we can do that. So to avoid all these hair lice, dandruffs, hepatitis, HIVs, and all that, I think we should try and keep our body clean and let it be part of us. Another part of the body that we'll be looking at this morning is our mouth. Our mouth. The kids are now on holidays, because when the kids are on school now, we'll be rushing. Most of us will even forget to brush our teeth. So we'll forget. No one is exception now. I think we've been a convict one way or the other. So we shouldn't no way try to forget that. That's the first thing we should do when we wake up from our bed. Let's try and maintain oral care. So by brushing our teeth, at least the mouth odor we are talking about, the tooth decay, the gum decay, it doesn't start big. It starts from all these minor things that we neglect, that we forget to do. Taking care of your mouth. Let's maintain oral practice by brushing regularly to avoid mouth odor, to avoid tooth decay, to avoid gums infections. At least twice a day, you should try and brush. Morning and after we go back from night. We should try and do this to do justice and to maintain personal hygiene. Another aspect we are going to be looking at is the hand. This hand, it harbors a lot of infections that we don't know. I do tell my kids when they are back from school, immediately go and wash your hand with soap and water, because the hand is an easier access to the mouth. So when we hold something or we try and dust something, we don't know, we forgot. We hold snacks. We want to take something to the mouth. So this hand, it harbors infections a lot that we don't know. There is something I showed my kids online then. I saw it on Facebook or I don't know. So they tried to view the fingernails under the aid of microscope. So the microscope amplified the nails. We saw a lot of maggot infections that is going about. So my kids was like, mommy, this is that is how it is if you don't wash your hand before you eat. All these things are what you are ingesting. All these things are what you are instilling in your mouth, and it brings infections. You just see the kids start coughing. It starts with coughing and all that. So it graduates to all these severe infections. So the hand is another aspect that we have to take good care very well, because it harbors a lot of bacterial infections, and we should try as much as possible not to trim our nails with our mouth. We are fond of doing that. Some adults are fond of doing that. They'll be maybe when they are gisting with their friends, unaware they'll be doing like this. We are ingesting bacteria unaware that we don't know. So that's why I said we should just try and look at all these areas. So God will help us in Jesus' name. So let's trim our nails with nail cutter. Nail cutter is just like 1,000 naira. Let's trim our nails with nail cutter. And let's encourage our kids to always wash their hands too when they are back from schools, to avoid all these infections. So in general, in personal hygiene, let's try and look neat. Let's look neat. The way we are, that's the way we'll be addressed. So let's try and look neat. Neat is the word hygiene. Let's try and look neat and to maintain all this personal hygiene we are talking about. So this takes us to, when we were singing the other time, we say imototo ara, imototo ile. So we want to look at the imototo ile, the environmental hygiene. How neat are you when they come for visiting in your house? Do they see everywhere being littered? Your bedroom, how neat are you? Your toilet is part of your environment. Your kitchen is part of your environment. So is grasses all around you? If you are harboring grasses, you are inviting insects. You are inviting snakes. You are inviting a lot of reptiles that can be harmful to the health. So all this hygiene that we are talking about is just for our own personal good. It's for our own self. We are not being hygiene for anyone. We are not impressing anybody. Even if we say, okay, looking good is nice. But the first person to benefit from this is us. Is we personally. When we are taking care of our body, is a beneficiary to you. So when we are taking care of our environment, we are trying to prevent some infections, some bacteria. You don't want to be sick. So you have to take care of your environment. You don't want to be spending money unnecessarily on health. Well, we are available. You come to the pharmacy, we'll give you drugs, give you antibiotics and all that. I'll collect money. So, but we just have to look into this so that we will not be spending. There are a lot of things we can spend money on than just buying drugs today, treating typhoid today, treating malaria today. So all this, when we look at our environment, our surroundings, when we clean it, it's free from gutters, no stagnant water around us. Stagnant water invites mosquitoes. And infected mosquitoes, they cause malaria. So all these things we should try and, now, if anyone come down, say I'm here in the pharmacy, the first thing we'll ask is, when was the last time you treated malaria? Because, this Nigeria as a whole, it's malaria endemic country. So now, when was the last, because we know that most people, there's stagnant water, there's no way mosquito will not skip in. So when we try to avoid this, at least we'll cut half of all these chances of coming down with malaria today, treating this and that tomorrow. So when we are neat with what we are doing, cleaning the gutters around us, cleaning the bushes, fumigating to kill some insects that might be harmful to our health. So this would prevent any environmental infections and all that might try to penetrate into our house. Another thing I want us to look on under the environmental hygiene is our convenience, the toilet. Do we clean it well? When we have a visitor, it's very important for us, after the visitor left, just try and use maybe Harpic or Dettol to disinfect, not for anything. Well, it's not written on the face, this infection we are talking about. We are talking about personal hygiene. Then there is infections, urinary tract infections, gonorrhea. You wouldn't know who has it. It's not written on the face. So it's advisable after the visitor left, just try and disinfect it with Harpic or Dettol just to kill any form of bacteria that you can attract when you use the toilet after the person left. So our convenience is another thing we should try and make it clean as much as possible, so to eradicate any form of infections. So we'll be looking at food hygiene. I said it will be so brief so that we can have time to ask questions. So imototo onje, this is very, very crucial. This is very, very crucial. What goes into our mouth is what, in fact, I don't want to use the word kills. So if we don't preserve our food very well, there is all these small cockroaches. In fact, they are very small, they fly. So we should be mindful of how we keep our food, and unclean water. So one of the greatest risks to the health of a population is a contaminated food and unclean water. So leaving our food open, that is not keeping our rice, gari, yams, so you get. So all these things, when we leave them unkept or we don't close it well, we open one side of the gari, open one side of the beans. So all these cockroaches will come, they contaminate it, we cook and we eat. So from there, all these small things are where we get all these infections from that we don't know, especially the food. Well, I wouldn't say we should not get food outside, but watch where you get your food. because the kind of water they use in cooking the food, they are not hygiene. You don't know where they get their water from. So at least when we reduce our chances of getting food outside too, that would help us to from coming down with all this food and all that, our food getting infected. So another infections that we can get through, this typhoid of a thing that we are saying, only typhoid, only malaria, malaria. Typhoid is a bacterial infection, Salmonella typhi. It's gotten through water, unclean water and unclean food. That's the source of this typhoid we are talking about jẹun níbi tí wọn ti wà hygienic. I remembered one time I went to do something at Okemosan. In fact, I was so hungry, I was so famished. I need to get amala and ewedu. That amala and ewedu, my kids ate out of it with me. In fact, in the next 30 minutes, everybody started stooling, started vomiting. I already knew that I knew that it was the result of the food I ate. Because they might open the ewedu, all these microorganisms, you can't see them with the head of the eye. So they are not so hygienic enough. It might be the elubo that is contaminated. It might be the soup that is contaminated. You wouldn't know which one. So let's try and be hygienic in keeping our food well. Another infection that is very chronic is cholera. Cholera is a deadly infection. It kills fast because the symptoms is you pooing, vomiting at the same time, simultaneously. So simultaneously you pooing, you vomiting. Well, cholera is not so prominent in this area, but it's so prominent in the rural areas because most of them in the rural areas, they don't have access to good toilets. They don't have access to good toilets. They use the river. If they want to bathe, they go to the river. They want to take water to cook, they just do the water like this, and they take the water, and they drink it. They don't have access to tap. They don't have access to good waters. They don't have access to good toilets. That same river, when they poo, they throw their poo in the river. Same river that is contaminated, same water they would drink. So that's why cholera is very, very much in the rural areas. So another infection is cholera. When the water is disinfected, the water is infected. The water we drink, we should be mindful. Let's make sure that we get access to good drinking water that is not contaminated. So, and all these risk factors is traveling. Maybe when we travel to greet our friends, there are some people that they tend to react to change of environment, change of water. In fact, change of water, when they come down, most patients will tell me I traveled, and where I traveled to, the kind of water I used to drink is, I got another water. They are reacting to the water. So they start vomiting, they start pooing at the same time. So we try and give antibiotics to stop the growth of the bacterial infections in their body. So the food we are consuming, let's handle it well so that we would be free from all these opportunistic infections. So we move down to benefits and the advantage of practicing good hygiene. We've been talking about good hygiene. Is there a benefit? Fine, we've spoke about the benefits. We've touched some parts of the benefits. So we are going to be checking at it one by one. Does you practicing good hygiene, does it have a benefit? Yes, it does. Does it have advantages? Yes, it does. Number one here is it reduces the risk of infections. Yes, when you practice good hygiene, when you keep your food well, when you keep your body well, when you keep your environment well, number one thing that it does is it reduces the risk of infections like common colds, flu, cough, diarrhea, skin infections, and all that. So it reduces the chances of coming down with all this coughing and all that when we are practicing good hygiene, when we are hygienic in what we are doing. So the another advantage here is it lowers medical expenses. I said it that you treating malaria today, treating typhoid tomorrow, spending money unnecessarily. We have a lot of good things that will be beneficiary to us, that we can spend money on, that we can divert money to grow business, and a lot of that. So when we are hygienic in everything we are doing, it won't make you spend unnecessarily. It lowers medical expenses. It lowers medical expenses. There is a saying that prevention is better than cure. What we know that we can prevent through the means of being hygiene, let's prevent it now so that we won't end up getting in contact with all those infections and spending money on those things. So we can prevent them now. Prevention is better than cure. So it is cheaper to prevent than to treat. It is cheaper to prevent than to treat. So another advantage here is it increases our self-esteem. When we are hygiene, when we smell nice, you will be confident to stand outside. You'll be bold to speak anywhere. So it increases our self-esteem, especially in a social gathering. So you maintain oral practice, your mouth is smelling nice, you are even feeling yourself where you are. So talk less of others beside you. So why won't they feel you when you look good, when you smell nice? So it increases our self-esteem. You not feel inferior. Oh, I'm not dressing well. The odor that is coming out of my body is not good. No. It makes you stand confidently in the public. So another thing is it improves our mental clarity. Yes, it makes you focus well. When you are in a class or you are in an environment that is very dirty, you will not feel comfortable. You'll be doing like this. Mosquito is biting you, you shift it, you do like this. Fly is moving around, you do like this. So it will make you focus. You won't focus well. So it improves our mental clarity. It makes us focus well. When you are good, when you practice all these things we are talking about, it makes you bold. It makes you feel yourself when you are in a clean environment. So the last to crown it all on the topic is there is a word that we Christians usually say that cleanliness is next to godliness. Our God is neat. Ọlọ́run wa ò ń ṣe Ọlọ́run tó dọ̀tí. So our God is neat. So in all we are saying to crown it all, we say that cleanliness is next to godliness. So we heard just this morning that as we diligently pursue godliness, we should also pursue cleanliness. We should also pursue cleanliness in all we do. It's just for our own self, to prevent all these chances of infections and all that. In fact, it's not something we should look out with levity. Most of people that are sick today, most of it, if you look at it very well, is lack of all these things we are trying to talk to ourselves. They are not practicing all these things. And they think it's just a normal thing. They don't. So, but when we do all these things we are trying to encourage us, we get it advantageous to our health. We won't get sick. We won't spend money unnecessarily. We will enjoy our health. We will be in perfect health. May God help us as we are willing to do all these things in Jesus' name. So we are moving to the next topic. The second topic is basic first aid. First aid. We have one in the children class. For anyone that does not know what first aid means, we can check our children class. We have a first aid box and it's well equipped. So now we'll be looking at basic first aid. What do we mean by first aid? I'll be calling people now, but I think we are responding. So what do we mean by first aid? First aid. You know, I said all this, today's topic is what we know. But it's just to enlighten us on how to do them right. Most people, peradventure, we have not been doing all these things right. We have not been applying the right way. We are not doing them in the right way we should do them. So this morning, we'll just encourage each other and to open wider knowledge more on how to do them better. How to do them better in the right manner. So first aid. Okay, if you can't say what first aid is, let's mention the first aid equipment we know. Maybe we'll now go back to the definition. Paracetamol, yes. Paracetamol is part of first aid equipment, yes. Iodine, hey, Panadol, spirits, yes. Cotton wool, bandage, yes. Bandage is part of what should be there. If it is crepe, there should be rub or analgesic ointment. Maybe pain relief gel should be there. What again? Scissors should be there. Should be part of our first aid box. Scissors should be there. Sorry? Coke. We don't pray for major accident. No one will be weak. No one will be weak. No one will be dehydrated. No one will fall down. You want Coke, don't worry. Pick milk. Mommy Joanna, milk. Okay, mommy is listening to all these things. Mommy Shengbo, they said they need Coke, they need milk to be in our first aid box. So that's that. I think we've mentioned a lot of kits that should be in our first aid box. That's fine. But the word first aid, it's a medical attention. Let's look at that word. It's a medical attention that is usually administered immediately. First aid is a medical attention that is usually administered immediately to any person after an injury occurs. After an injury occurs. Without an injury, we don't need first aid. Yes. So, immediately to any person after an injury occurs before medical aid can be obtained. Before medical aid. Let's look at that word too. Before medical aid can be obtained. First aid is not the last thing we should do. Especially in major accidents or in major injury. We shouldn't end it in first aid though. What we are just trying to let us know is to prevent further harm from happening to the individual that got injured. So it's just a thing, something we can quickly do just to make petrol. Yes, before they get to the pharmacy, they want to tap petrol. See, they will put kerosene. They said they want to stop the blood. Hey, all these things, they are not the right ways of doing them. So we want to encourage us how to do them right. Some people would put all those people at the tipper garage that they deal with cars and all engine oil. They will pour oil, they will pour petrol before they get to the pharmacy. I will be like, what is all this? You are instilling infections. We are putting more bacteria. We are causing more harm. Yes, they are lubricating it. Sir, so the right way of doing all these things is, we've mentioned some first aid equipment. We can make use of our hydrogen just to stop the bleeding. Or Mommy Joanna said something. We should tie a rope, a neat one, immediately. We should just look for maybe one shirt, to tie so that there will not be loss of blood. So that the person injured will not get more weaker. It can bring fainting. So we want to prevent life, to save life. That is what first aid is. Basic things that is all about. So the right way of doing that is, let's get a tourniquet. I don't know if we can't get a tourniquet, let's get a clean rope, a clean cloth to tie at the base on where the injury occurs to stop blood flow, so that the individual will not lose a lot of blood before we can try and move the person to hospital for further medical aid. So now, in the definition we said first aid is a medical attention that is usually administered immediately to any person after an injury occurs before medical aid can be obtained. Before medical aid can be obtained. So we should look forward in, like the scenario I just cited, move the person down to the hospital immediately. And again, before we look or we come into first aid or we try to administer first aid, let's look at the situation. Let's try and check the individual well, because a lot of people, because that road my pharmacy road, when they tell it, a lot of accidents has been happening one after the other. So when they bring them in, when I assess the situation, move them to the nearest hospital. You can't just stay with this, because the person will, or there is a lot of blood on the head. So such person, you don't try and just move that person, because it's an emergency. It's an immediate thing that we have to attend to urgently. So let's move the individual to the hospital. But if it is a minor wound, minor injury, we can make use of our first aid as equipment to clean with cotton wool, clean with spirits. If the blood is still coming out, we can make use of our hydrogen peroxide to stop the blood from flowing. Put your iodine, get a small gauze or cotton wool, put it, and get your plaster. We didn't mention plaster. So I get your plaster and just make it fine. So it must not end with you, especially in a major injury. So move the injured person to the hospital for proper care. So we have some goals of first aid treatments. The goals, why do we do first aid? So the purpose of first aid is to preserve life, to prevent further harm from happening to the person, and to promote recovery. We are trying to preserve life. When we try to sort and do some first aid activities, we are trying to preserve life, we are trying to prevent further harm from happening to the individual, and we are trying to promote recovery, to relieve pain, to relieve discomfort, and to relieve distress or whatever the individual is going through. So that's why we are trying to prevent. So there are some 3 areas I put down here that we want to look into. I said areas of first aid care and how to assess the situation. I've said one, which is bleeding. In case of bleeding, maybe someone peradventure use scissors or any instrument to cut his or her hand unaware. How do we assess to that situation? How do we attend to that situation? Bleeding. If you want to control bleeding, this is what you will do. We said we should first, in fact, escape the blood from coming out so that the person would not be weak and be dehydrated. So we can first control the bleeding by applying a direct pressure using a tourniquet or a clean cloth at the site of the wound or above the wound, because we are trying to reduce bleeding. So another thing is, let's elevate the injured area. If the injured area is our arm, let's try and elevate it so that there will not be blood that will be coming down. So let's try and do that like this, or try and place the individual flat, raise the head above the heart level so that the blood will be reducing. So after that, make use of your cotton wool to support the injured area until medical aid arrive. Don't leave it there. We are trying to prevent, to promote, and to preserve life. So after that, let's try and move the individual to the hospital immediately. So another area is burns. When we are talking about burns, fire accidents, gas explosion, maybe there's all this bike spoke and all that. When it will be pepperish at that moment. The pain will be so massive. Pour water for like 10 to 15 minutes. First run a cool water. After you run a cool water, get a topical antibiotics ointment. Like all these are penicillin ointments. So just rub it on top so that the wound, that is still a fresh and open wound. So anything can come in contact with it. So the antibiotics would prevent that area from maybe tetanus or all these microbes that can contact in the wound that can cause skin infection. So that will prevent it. Even if they come contact with that penicillin cream, it's an antibiotics. It repels whatsoever that can come in contact with it. So let's run a cool water. After that, let's get a topical antibiotics like our penicillin to prevent infections, and let's use a pain relief medication. Let's use our paracetamol. In case of bleeding too, there will be pain. Let's use our paracetamol. At least the person will still get himself before medical aid arrive. So, and after you've used the pain relief medication, you seek medical attention. Because all these little things they get amplified, they get big with a lackadaisical attitude. We'll be nursing it, we can do it. It turns to a bigger wound. So it starts expanding, start getting big. So let's try to seek medical aid after all these first aid we are trying to apply. So the last aspect we'll be looking at is fractures. In case maybe we jumped from fence down. My leg broke. Or our son was jumping from the chair. Bam, they are doing yamiko got broken, or their hand, or the fracture, there's a fracture or wherever. At that point we wouldn't know what has happened to that person. So don't let us add to the injury. So what we need to do in case of that situation is, firstly, let's apply ice pack or cold water. First, put it on that place. It can't be okay. Apply it because there might be inflammation, there might be swelling. So that would reduce the swelling. It will reduce the pain. Apply ice pack immediately or cold water. Just put it on the site of the injured area. So after applying the ice pack to reduce swelling and pain, we get an analgesic. We get an analgesic ointment. So someone was mentioning rub. So something like Rob is not an analgesic though, but there is a better one that we can get. They are all cheaper. All these first aid kits, if you want to equip them, we can't spend up to 5,000 naira. They are all cheap. Cotton wool 200, gauze 200, spirit 400. They are not expensive as we think. At least we should get them in our house for little things. Any little thing can just happen to our children. So at least we first try and do something before we move down to the hospital. So, and when we are trying to attend to that case of fracture or broken bones or whatever, so don't let us rub the site rigorously. I'll give us a scenario. My son Oba, some years back, they traveled for holiday, that festive period. So they were throwing banga in Shagam. So everyone was playing outside. It was on the chair. So when they threw the banga, everybody was now rushing, banga, banga, banga. The boy, they pushed his chair. He fell down from the chair. He fell down. So he used his hand to support the floor. So I think the hand the hand was paining him anyway. So they called me, Grandma called me, hey, what is you boo? What is she? I said, okay, don't worry. Just use paracetamol for him. I think he'll be fine. I didn't know that it was something that would be serious. So when I think they came to Abeokuta back after the 3rd or 4th day. So the boy kept complaining that my mommy, my hand is paining me. I said, your hand is paining, I will use paracetamol. My hand is paining me the next day. If it is just minor pain, at least with all this pain reliever I'm using, it should just subsided. So I just need to say, what's happening? Okay. I moved the boy down to Ijaye General Hospital. We went to see a physio. That's because I wanted to say, okay, let's go and have an x-ray check, but I don't know how to read the x-ray. So even if I go to see the physio will not even take the x-ray you went to do. They will say, go and do another one. They will refer you to another place that you go and do the x-ray yourself. So I just took the boy to the physio. I think every Tuesday we should be there early in the morning if you want to see, because the consultants, they normally come once in a week. So they scheduled another day, maybe it was the 2nd day, we got the card when we saw the physio. So before that, I think they were trying to rub the hand or to try and straighten the hand. While doing that, there is, in fact, a lot of things that has actually happened to the hand. So they've worsened the case. I think, a fracture, if it was a fracture before, it will break when you were trying to do it rigorously. So they don't know. They want, the physio asked us a question that, when the thing happened, did you massage it? Did you do it? I said, I think they did it, sir. I'm sure they will do that. I am very, very sure. So he said, well, there's a fracture. So when we've done the x-ray, the physio checked it, there's a fracture. Hey, said fracture. Hey, for the next 1 month, they had to put a POP in the hand for 1 month so that the fracture will come back to normal. So to gather the flesh back so that it won't become a crack, or it will, if a wall crack, if you don't attend to it, it will break. So that's what they were trying to do. So in case of fracture, don't let us apply a pain relief gel rigorously. We should try and, if you have a pain relief gel, just massage it. The pain relief ingredients will penetrate. It will penetrate inside the flesh. It's not how we are applying it rigorously that will make it. So let's just apply it with. We don't know this. At least we'll try to get 1 or 2 things from everything we've been saying. And the last but not the least, seek a medical attention. After using the pain relief, get a physio that would try and work on it. So the last word here is, remember, first aid is not a substitute for medical care. It's not a substitute. Therefore, if someone is seriously ill or injured, let's call for a medical help immediately. Thank you for listening.